Hi, welcome to the On Call with Catherine podcast. Welcome to the first episode. I'm Catherine Grant, founder CEO of ExperCARE Health. In today's episode, I'm going to be talking to Dr. Keith Seibert, who recently joined us as the director of Pediatrics and Preventative Health. Today, we're going to be getting into this new model. We're going to be talking about the why behind it. We're going to be talking about what is on-demand healthcare and how does that compare to urgent care and primary care. We're going to be talking about some common misconceptions around that model. And we're going to be talking about functional health, something that we're going to dive into later in the season. So stay tuned. It's going to be great. Welcome to the On Call podcast with Catherine. I'm Catherine Grant, founder and CEO of ExperCARE Health, wife and mom to 3 precious girls. If you're an entrepreneur, a mom, or work in healthcare and you're looking for insight, tips on business, leadership, healthcare, and just juggling a busy season of life, this is the podcast for you. So pop in those AirPods and let's dive into the episode today. Hey, it's Catherine. Today we are going to be talking to Dr. Keith Seibert. Welcome, Dr. Seibert. Thank you for being here today.
Thank you. I am so excited. I'm so excited to talk about what we're doing at ExperCARE and about ways of staying healthy.
Absolutely. As some of you may have already heard, Dr. Seibert and I have teamed up to do some really exciting things in healthcare, starting in Richmond Hill and then expanding further. But I want to take it back a little bit. I want to take it back and go back to, when you think about it, what was your first aha moment about, hey, I'd like to do something a little different than the traditional primary care model?
So I have 2 answers to that, Catherine. The first one is, as a pediatrician in Richmond Hill for about 21 years, I know that I have had the best job in the entire world. But about 15 years ago, this upstart urgent care started in Richmond Hill, 2009. And I realized for the first time that the model that I was working in, we call this conventional healthcare, doesn't meet patients where they need us from the access standpoint. People, and I'm sure a lot of you can relate to this, but people wait a long time for one person as their primary care doctor and don't get to benefit from the true concept of either 7-day-a-week access or from really good teamwork. And these are things that I've tried in the conventional model to work on, and I really think ExperCARE is now giving me an opportunity, and it's become clear that this is the way to solve the access dilemmas. And then my second answer to that question is, in the last 5 or 6 years, I've really started to think differently about the care that I provide. And for years, I have seen patients who have waited patiently to see me to diagnose their illness, to start them on medication. And I still am sure that I'll be doing some of that. But I'm starting to, and I have for now several years, looked at what we call functional medicine, which is the view back upstream. How did we get here? In fact, one example I sometimes use is that patients with chronic headaches may go to their doctor expecting a headache medication. I think that's a conventional approach, and some people are satisfied with that. But I start to ask, well, why did we start getting headaches now? And if the issue was that you're not sleeping well, or that your nutrition isn't great, or that you have broken relationships and stress and anxiety and depression, or difficulty in other aspects of your life, if those are the underlying problem that led to your headaches, then maybe the answer isn't just a headache medicine, but a deep dive into some of the things that you could have done and you can do now to avoid those headaches in the future. So that's my second answer.
Yeah, that's great. So what I'm hearing you say is there's this dynamic of episodic care, which is often reactive and needs to be by nature. And we've often associated that with the term urgent care, right? Because in the traditional model, you can't get in to see your primary care doctor because, let's face it, there's not enough to go around. I mean, there's data that shows that. There's a shortage of primary care access.
If you Google the word shortage of primary care doctors, you will see literally tens or hundreds of thousands.
So by necessity, to keep people out of the emergency room, which really should be for true emergencies, urgent care's popped up.
Correct.
Right? To take care of the episodic care, the reactive care that the traditional model couldn't absorb based on the way it was designed.
So that's right. And ExperCARE did an expert job of that for the last 15 years. And although I think it's a step in the right direction, I think the reality, and maybe the holy grail, is to realize that distinction between episodic and what some people call longitudinal or primary care is really it's unfortunate that there is a distinction, and it's really somewhat artificial, which is the things that lead you to become sick can often be handled best in the context of a relationship with a team that knows how to help you keep from getting sick in the first place. And right now, with a fragmented care model, and I've seen this again, 21 years in this job, watching my patients go to one urgent care or another, in the hopes of finding the best care, many times they are unintentionally assembling a team of professionals who don't communicate. There's no awareness at their primary care doctor that they've been to 2 different urgent cares, and there's no way to see the x-rays that were done there, or even to know what the lab showed or what medicines have been tried. So in primary care, I'd see a patient who tells me that they need to have their tonsils removed. And I'd say, why? I look back, you haven't been here for a year. Everything looks great from my end. And I say, well, I've been to 3 urgent cares. And they told me that I had sore throats, but all the steps are negative. And they told me to take antibiotics anyway. And I hear this story so many times. I look in the mouth, the tonsils look pretty good.
Yeah.
And I realize that I'm not capable of taking the larger view of my patient's healthcare. And we're looking at this fragmented story, and I'm left with this dilemma. Do I recommend surgery for someone I've never seen to be sick? Do I not, and let them continue with episodic illness that I'm not available to take care of? So I think this model, this goal of eliminating this barrier and offering episodic care at the same place where a team understands you, your life, your health, is the model that we've been looking for. And I'm so excited to build it with you.
Absolutely. We're excited too. I mean, it's interesting when we start comparing from the lens of a traditional model and the challenges there, and for years seeing the challenges from the episodic side of being expected by insurance companies to have people follow up with their primary care provider, only to find they can't seem to get in with them, so they end up back with us, and we're happy to take care of them. Then I think what a lot of people don't recognize is that often the providers, you talked about this sort of faulty sense of separation or siloing between the two models. The providers often have at least the APPs have the same core training. The same core training. And when I say APPs, I mean advanced practice providers. So those are the PAs and NPs that are at the backbone of the front line of delivering healthcare. And I believe the solution to the shortage of primary care in the country, if we can figure out how to use them as part of a team, and not just silo them alongside a physician and tell them, you go over here, see your separate sides of patients.
And that misses the entire point.
Right.
About 7 years ago, my wife Heather actually taught me the most that I've learned about teamwork, which is she's a clinical pharmacist. And I realized one of the greatest bottlenecks I had was in helping people who were struggling with the epidemic of anxiety and depression, school difficulties, school failure, attention problems. Those visits by necessity need time. And that was the one thing that I was unable to give. I didn't have an extra 45 minutes today to go through the story of why someone is anxious. The roots to anxiety are deep, and many of them come from personality traits that are actually great strengths. Intelligent people are the overthinkers. Sensitive people want things to be better. So if you're thinking about making things better, you're more likely to be anxious. However, getting to the root of that and embracing that is something that, as I've worked alongside her for 7 years, realized that we can do this in a teamwork sense that's very effective. And I think my patients have really benefited from that. And as we add in APPs with different diagnostic skills, people who can help carry the ball on every manner of illness, I realize that is the team model that I've been moving towards that healthcare needs.
Absolutely. So this concept, I love to say, what if you didn't have to figure out where am I supposed to go for this particular thing? When I listen to my friends and my relatives, so many text messages that I get, so many phone calls I get because people know I'm in healthcare.
Sure.
And we've designed this model in health, or not designed, I think we've defaulted to this healthcare model where we expect the consumer to figure out who they're supposed to buy from. And they have no idea on the training. So you and I talk about this analogy quite a bit, but it's this analogy of my car is making a noise. Do I need the transmission person? Do I need the air conditioning person? You know, I don't even know all the parts of the car. You probably do. But the wheel person, I mean, why is this thing making the noises? We just take it to the car place. And then the car place has the air conditioning person and the oil person and the tire person. And they make sure that person have a way to triage that, determine who is best training to take care of that particular issue with the car. And all the consumer has to worry about is, my car's making it, the symptom.
That's right.
My car's making a noise.
Absolutely.
And so imagine if we take that same concept and translate it to healthcare.
That's exactly where we're going with this model. I've had a lot of my patients ask me and say, well, how do I make an appointment for a follow-up? And I get to say for the first time, don't make an appointment for a follow-up. When it's convenient for you, come. Yeah. Your chart will say what we're supposed to do next. If I'm here, I'll see you. If you need to see me for some reason, I'm happy to make an appointment with you. I'll see you then. But if it's more important to you that you meet your children's needs or your own needs in a format that's convenient and accessible for you, you can go to any of our locations and the chart will detail where we were headed next in your healthcare. One thing that to piggyback on what you've said is that one of our goals is to care for you like we care for our kids. And so one thought that I would kind of approach with that is that with my own daughter, Caroline, if she had a sore throat today, I wouldn't call somewhere and make an appointment maybe for 3 o'clock this afternoon. I'd bring her into the office. And one of the team would be able to take a quick look at her, swab her throat, give us a quick answer, and I can make a decision. Can she go to school? Does she need to stay home? Does she need medication? And we could sort that out in about, I don't know, 5 minutes.
So this actually happened yesterday, and I can release this because it's about my daughter. I know you wouldn't because it would be a HIPAA violation, and we take that seriously. Yeah. But yesterday, I got notified from the athletic trainer at Country Day, where my child goes to school, that she had flagged a concussion screening exam, and they thought that she had a concussion. And yesterday was actually the first day that we were doing complete walk-in in the Richmond Hill pilot location, and I knew Dr. Seibert was there that day. And so we just brought her in. We brought her in, and we've got a great team that can start that. But I was also confident that if they needed to bring you in to that case for higher level decision making, that could and would happen.
That's right. And if there's perfect, one thing very clearly I think that we all should see in that is that there wasn't a special spot for Catherine Grant's daughter because she needed the spot. The same care would have happened regardless of who walked in.
Right. And so our answer now, which is so exciting, and I think is what catches people off guard, because I hear it over and over, is, well, I mean, just come in like now? Like right now? Or, I mean, but for those of us that like a little bit more control over our schedules, you can book ahead. You can go to our website, you can book an appointment, reserve that ahead of time, go ahead and get your paperwork going online, get your insurance card in and all that good stuff. However, yes, you can just come in. And we really want to meet, part of meeting people where they are is all ages, removing barriers, extended hours, 7 days a week. And we take insurance, no insurance, not an issue. We've got transparent cash pay pricing, so you don't get any surprises. And all the things you love about urgent care, right? We've got X-ray on site. We can do procedures. We can do sutures. We can do laceration repair, all of those things, but also rolling into, but what about long-term? Right? What about long-term? You have me thinking about, you talked about the tonsils, same with tubes and the ears, right? How often the ear infections end up in an urgent care because it happens after hours, right? And they're miserable. I mean, as a mom, as soon as I saw that fever, kid had a runny nose a day or two, and I go, here we go, another ear infection, right? And I know if I wait to start treatment, it's going to be worse. That's right. Are we going to be up all night long? So we don't blame people for seeking that access to care.
We just want to provide it.
We want to provide it. And then when we need to make a decision, is there something else interventionally we need to do because this is becoming a pattern?
That's right.
We've got the documentation.
That's right. One of the problems with, I think, the conventional approach is that you have providers of variable expertise. And the idea of walking into a random care facility to see someone who might have years of pediatrics or years of hypertension under their belt, or might have 6 weeks from school years ago. You don't know, right? I don't know. But those decisions regarding serious potential health consequences like surgery are made by someone of variable experience. And our team, the person with the right experience and the most experience, is going to inform those decisions.
So one of the most exciting things about this model is we broke it down and sort of went, how do we do this? How do we do this differently? is that we've created this internal escalation, if you will, so that we can utilize the team-based models. We may break down something that would take 45 minutes if you were to wait a month to get in and see someone, and we break it into an initial 15, 20-minute visit, maybe a follow-up to do some labs and some workup, and then that follow-up visit where we've got all of that information can either be with someone on the team, or if we determine this is pretty complex, we really need to pull someone in with some specialized training, we also have access to that.
That's right. And we realize as part of our team that we will be able to provide care for the vast majority, but not all of the community. And when a problem shows up that really needs a cardiologist, we will be your ally finding us out. When you need a nephrologist or radiologist or advanced imaging that we can't provide on site, we can access that for you as we would access it for our own children and families.
Yeah. And then we're right here, hold your hand until you get in, because sometimes it's not tomorrow, making sure that if that does progress, in the meantime, we can help escalate that request if needed.
That's right.
Which is, like you said, going back to, it's what we do for our own families. It's what we would want for those we love. And to be able to extend that to the community is really exciting. It's exciting. As we think about some of the common misconceptions with this model, I know you get questions, you're getting texts. Right. What does this mean? Is there any common misconceptions that you're hearing you'd like to address to somebody who might be listening today?
Absolutely. The first one I think you've already alluded to, which is this question of how do I make an appointment? If it's for a short-term concern, the answer is don't make an appointment. Show up. We got you. We'll cover you. And if it turns out to be something that needs a lot of time, our team has learned how to break that in to manageable chunks that really respects your time. If lab results need to be included and those take a week to come back from our lab, then let's get that ball rolling, and then let's set time next week to review them with you. I think the second one I run into is based on the conventional model, which is that a primary care doctor is the primary bottleneck in care. And they're also the solution to care. We have a wonderful family practitioner, Chris McGee, coming on board. We've got experts, board certified experts in emergency medicine and occupational health. I work in pediatric, adolescents, behavioral health, nutrition. And together we can find most of the care you need. And in fact, as a primary care patient, when someone asks, can you be my primary care doctor? What I like to answer now is that ExperCARE can be your primary care doctor. And so if you need help with your blood pressure or your lipids, we have people who are expert at that. It's wonderful. Yeah. If you need help with your nutrition, which might relate to your blood pressure, then I'll help you with that. If you have issues for any other of a number of specialty problems, I was just talking to one of our APPs yesterday who quizzed me as a physician on different forms of skin cancer. Someone who's done a lot of pediatrics and adolescent medicine. I don't see a lot of 70-year-old skin cancer. He is an expert on these things. And it was so great to realize that if I see someone with a worrisome spot, I've got someone with that expertise on my team. So I'm really excited to really implement this model in a way that just doesn't happen with most care providers.
So we've got access, we've got deep care, compassion, and I think about quality, because that was one of the core fundamental things that we were not willing to compromise when we talked about how are we going to do this. And I think we would be missing something to not touch on the incredible investment we've made to ensure quality and how we're doing that. So we brought on a vice president of advanced practice services who's helping Dr. Seibert and the other physicians really build this continuous education curriculum for everyone in the organization. So Tricia Howard, who's been a PA for 27 years and done PA education, she's a valued member of the team, but it's exciting to see what's happening behind the scenes to build this curriculum, because it's a huge part of the continuing education and the quality piece.
Sure, I can comment on that. When we think about the evolution of healthcare, the question about how urgent cares have helped provide access at times brings up concerns that it's created access without guaranteeing quality. Because as I mentioned, you might see a provider who hasn't spent time educating on the particular healthcare problem there. Of course, all APPs have a grounding in basic healthcare and do a great job of most of that care, but some problems need expertise. And by sharing and teaching those primary concerns that need to be understood at a deeper level, we can really improve that. Tricia is great. Tricia and I sit down regularly to review the curriculum to make sure that every provider here understands some of our expectations. Heather, my wife in pharmacy, in fact, one of the pharmaceutical principles in the pharmacy school is to make sure that data is driving the best decisions around what kind of workup and what kind of dosing and what kind of progression in treatments exist. So with experts like that around me, I can promise you that we'll deliver a level of care you can't find at other walk-in or on-demand care.
Absolutely. This has been awesome. We've got so many things we could continue to talk about, but for those who have been intrigued by this or want to know how can I learn more, or gosh, I haven't been to a primary care doctor in a long time because I couldn't get in or it didn't work with my schedule. Excited to say now, today, you can walk in at our Richmond Hill location, which is where we're piloting this model. We're excited to expand it to additional locations in the future, so stay tuned. If you go to ExperCAREHealth.com, you can get up-to-date information there. Follow us, follow the podcast, follow us on Instagram and Facebook.
That sounds great. And in a few months, as we continue to roll out both education and information for our valued patients, we're going to start including more nutritional and preventive and functional health tidbits that I think for me are fascinating, help me as a dad think about how I'm taking care of my family, and I can't wait to help you guys figure out how to do that for your families as well.
I am so excited about that. I'm bringing my notebook, taking notes. So much to learn. He has so much wisdom about hacks on how do you get healthy, how do you be the best parent, how do we pour into this family unit, that we're excited to take care of at ExperCARE. Not just urgent care, not just primary care, ExperCARE. Thank you.
Thank you.